Have you ever found yourself in a moment where you wished your body would just cooperate? You're ready. The mood is right. But something just isn't quite there. It's a deeply personal, often unspoken frustration that many men face, especially as the years go by. This isn't just about a fleeting moment of disappointment. For many, it becomes a quiet source of anxiety, chipping away at confidence and even affecting relationships. It's a reality that can make you feel isolated, wondering if it's just part of getting older and something you simply have to accept. But what if I told you that a common, often unconscious habit, something many men do regularly, might be silently sabotaging your ability to get and maintain an erection? It's a mistake that, as a penis surgeon, I see the subtle, long-term effects of far too often. We're going to gently pull back the curtain on this often overlooked issue, exploring exactly what this mistake is, how it impacts your penile health, and most importantly, what simple, actionable steps you can take starting today to reclaim your vitality. In this conversation, we'll uncover the surprising truth behind this common habit and how to correct it. Watch to the end for something that will truly surprise you about how you can powerfully impact your own health and confidence. Let's dive right into what I often see in my practice, something many men don't even realize they're doing. It's a subtle yet significant issue that can gradually diminish your ability to get hard. And it often stems from a seemingly harmless habit during masturbation and over-reliance on a very specific, often intense, and often non-natural form of stimulation. Think about it for a moment. Over the years, many men develop a routine, a particular way of stimulating themselves that becomes incredibly efficient at achieving climax. This might involve a very firm grip, a rapid, repetitive motion, or perhaps a constant focus on highly graphic, visual material. The problem isn't masturbation itself. It's a perfectly normal and healthy part of male sexuality. The issue arises when the method becomes so specific, so intense, and so far removed from what natural, intimate touch feels like, that your body starts to learn that particular, high-level stimulation is the only pathway to arousal and orgasm. This can lead to a phenomenon often referred to as porn-induced erectile dysfunction, or masturbation-induced ED, though the term isn't quite right as it's not the act itself, but the method that becomes problematic. What happens is that your brain and your body's sensory receptors become desensitized to less intense, more natural stimulation when you're with a partner, or even trying to achieve an erection without such specific, high-intensity input. Your system struggles to respond. It's like turning down the volume on your favorite song until you can barely hear it. You need to crank it up to the max just to get the same level of enjoyment. Your penis, specifically the nerve endings and vascular responses, adapts to this specific, demanding input, making it harder to respond to the gentle caress, the soft touch, or the varied sensations of intimacy. The constant, repetitive, often forceful friction can also contribute to a kind of wear and tear on the delicate tissues and nerve endings. While the penis is remarkably resilient, consistent, high-pressure stimulation can, over time, dull sensation and even affect the elasticity of the penile tissue, which is crucial for achieving full rigidity. Imagine repeatedly rubbing a sensitive part of your skin with rough sandpaper. Eventually, it becomes less sensitive, even numb. Your penile tissue and nerve endings are no different. They thrive on varied stimulation, not just one type. So, what's the actionable step here? It's about gradually introducing variety and reducing the intensity and specificity of your self-stimulation. Start by experimenting with different levels of pressure, different speeds, and different types of touch. Instead of aiming for the fastest route to climax, try to explore the sensations along the way. Use a lubricant if you don't already, and choose one that allows for smooth, less abrasive movement. You might even consider incorporating your whole hand or using a softer touch, focusing on the sensory experience rather than just the end goal. It's about retraining your nervous system, allowing it to become responsive to a wider spectrum of arousal cues. Think of it as broadening your palate, moving beyond just one intensely flavored dish to appreciate a whole range of culinary experiences. This isn't about giving up what you enjoy. It's about expanding your horizons and helping your body remember how to respond naturally. Another crucial aspect related to this first mistake is the visual component. If you've become accustomed to highly specific, often extreme visual content during self-stimulation, your brain can start to expect that level of visual input to trigger arousal. When that isn't present, or when the real-life situation doesn't match that exact visual trigger, your brain might simply not release the necessary neurochemicals to facilitate an erection. It's almost like your brain has a very specific key for arousal, and if that key isn't presented, the door stays locked. Many men find that by gradually reducing their reliance on very specific visual stimuli, and instead focusing more on internal sensations, imagination, and the general feeling of arousal, they can begin to rewire their brain's response. It's about building a broader and more adaptable arousal template. This takes time and patience, but the rewards are significant: a more responsive body and a greater capacity for natural intimacy. Now that we've discussed the pervasive issue of over-reliance on specific stimulation and its impact, let's move on to the next critical area, which ties directly into the physical well-being of your most intimate parts. Continuing our discussion, another critical mistake that often goes hand in hand with the first one and silently undermines your ability to get hard is a lack of focus on overall pelvic floor health and core strength. Many men, in their pursuit of stronger erections, understandably focus on the penis itself, perhaps even trying various supplements or techniques. But the truth is, the penis doesn't operate in a vacuum. It's part of a complex system, and a key component of that system is the pelvic floor. These are the muscles that support your bladder and bowel. But crucially, they also play a vital role in erectile function. The bulbospongiosus muscle, in particular, helps to keep blood trapped in the penis, which is essential for maintaining rigidity. When these muscles are weak or dysfunctional, it can lead to what we call venous leakage, where blood that should be trapped for an erection starts to drain away, making it difficult to achieve or sustain hardness. Think of it like a leaky faucet. No matter how much water you pour in, it just keeps dripping out. Many men, especially as they get older, don't realize that these muscles can weaken, much like any other muscle in the body if not exercised. And sometimes, the intense, repetitive motions during masturbation, especially if done with excessive force or in awkward positions, can actually strain these muscles or contribute to their imbalance rather than strengthening them. The solution here isn't complicated, and it's often overlooked: targeted pelvic floor exercises, commonly known as Kegel exercises for men. These are simple to do and can be incredibly effective. To find the right muscles, imagine you are trying to stop the flow of urine midstream, or you're trying to prevent passing gas. The muscles you squeeze are your pelvic floor muscles. The key is to isolate these muscles and not clench your buttocks, thighs, or abs. Once you've identified them, practice squeezing and lifting these muscles, holding for a count of 3 to 5 seconds, and then relaxing for an equal amount of time. Start with sets of 10-15 repetitions, 3 times a day. It might feel strange at first, but with consistency, you'll notice a significant improvement not only in erectile quality, but also in bladder control. This isn't a quick fix, but a long-term investment in your sexual health. Furthermore, beyond just the pelvic floor, your overall core strength plays an indirect but important role. A strong core provides a stable base for your body, improving circulation, posture, and overall physical readiness for intimate moments. Simple exercises like planks, modified crunches, or even just regular walking and stretching can contribute to a healthier core. It's about viewing your body as an integrated system. where each part supports the others. This isn't just about erections. It's about feeling more vibrant, stable, and capable in your daily life. And when you feel better overall, that confidence naturally extends to your sexual health. Another crucial element often overlooked in the realm of self-stimulation and its impact on erectile health is the mental and emotional component. We've talked about the physical mechanics and the desensitization. But what about the psychological patterns we build for many? Masturbation becomes a quick release, a way to de-stress or to fulfill a primal urge without necessarily engaging in deeper emotional or sensory exploration. If the act becomes purely mechanical, focused solely on the climax, it can inadvertently train your brain to separate the physical act of sex from emotional connection or varied sensory input. This can lead to a situation where, in the context of intimacy with a partner, your mind struggles to fully engage because it's used to a very specific, often emotionless, and purely physical pathway to arousal. The mistake here is allowing self-stimulation to become a mentally disengaged activity, devoid of deeper sensuality or emotional richness. The actionable step here is to consciously infuse more mindfulness into your self-pleasure. Instead of rushing, take your time. Focus on the nuances of sensation, the feeling of your breath, the warmth, the subtle changes. Engage your imagination, not just graphic visuals. Think of it as a form of meditation, where you are fully present with your body's responses. This reestablishes the connection between your mind and your body, making your brain a more willing and active participant in arousal. Regardless of the specific external circumstances, it's about building a richer, more nuanced understanding of your own sexuality, one that isn't solely dependent on one narrow pathway. This mindfulness can then translate into improved responsiveness and enjoyment during partnered intimacy. As your brain becomes more adept at processing and responding to a wider range of stimuli and emotional cues. Next, we'll dive into a surprising, yet extremely common, factor that impacts men's ability to get hard, and how it's often exacerbated by unchecked daily habits. So, building on our previous points, another pervasive mistake, one that truly compounds the challenges we've discussed and silently erodes your ability to get hard, lies not just in the act of masturbation itself, but in a broader oversight neglecting the foundational pillars of overall vascular health. Your ability to get and maintain an erection is fundamentally a vascular event. It relies on healthy blood flow into the penis and the ability to trap that blood. Any habit that compromises your cardiovascular system, the intricate network of blood vessels that supply every part of your body, including your penis, is a direct threat to your erections. The mistake here is ignoring the silent warning signs and not actively managing factors like high blood pressure, high cholesterol, diabetes, and even chronic stress, all of which are rampant in modern life and often go unchecked or are managed inadequately. Many men might be focused on the immediate satisfaction from masturbation or trying quick fixes, while the underlying problem of arterial plaque buildup, endothelial dysfunction where the lining of your blood vessels becomes unhealthy, or poor blood sugar control is slowly but surely choking off the blood supply to the penis. It's like trying to fill a garden hose that's kinked or calcified from the inside, no matter how much pressure you apply at the tap. The water just won't flow freely. The daily habit that often exacerbates this is a lifestyle that promotes these underlying issues: a diet high in processed foods, sugar, and unhealthy fats, a sedentary routine with little to no physical activity, insufficient sleep, and poorly managed chronic stress. These aren't just minor inconveniences. They are silent assassins of your vascular health. For example, a diet rich in saturated and trans fats contributes to plaque buildup in your arteries, including the tiny ones supplying the penis. Sugar, particularly in excess, leads to inflammation and can damage the delicate lining of blood vessels, making them less pliable and less efficient at dilating to allow blood flow. A sedentary lifestyle directly impairs circulation and can lead to weight gain, which further strains your cardiovascular system. And chronic stress. It floods your body with cortisol and adrenaline, which can constrict blood vessels over time, reducing blood flow where you need it most. The actionable step here is a comprehensive commitment to heart health, because what's good for your heart is phenomenal for your penis. Start with your diet. Focus on whole, unprocessed foods. Think vibrant fruits and vegetables, lean proteins like fish and chicken, healthy fats from avocados, nuts, and olive oil. Reduce or eliminate sugary drinks, processed snacks, and excessive red meat. It's not about deprivation, but about nourishing your body. Incorporate regular physical activity into your daily routine. This doesn't mean becoming a marathon runner overnight. Even brisk walking for 30 minutes most days of the week can make a significant difference. Exercise helps improve circulation, lowers blood pressure, manages blood sugar, and helps maintain a healthy weight. Aim for consistency rather than intensity. Prioritize sleep. Your body repairs and regenerates during sleep, and chronic sleep deprivation can throw your hormones out of whack, increase stress, and impair cardiovascular function. Aim for 7 to 9 hours of quality sleep each night. This means establishing a consistent sleep schedule, creating a relaxing bedtime routine, and optimizing your sleep environment. Finally, manage stress. This is often easier said than done, but chronic stress is a known libido killer and erection damper. Find healthy coping mechanisms, meditation, hobbies, spending time in nature, connecting with loved ones. Even simple breathing exercises throughout the day can make a big difference. For many men, the surprising realization is that the mistake isn't a single isolated act of masturbation, but a confluence of lifestyle factors that create a challenging environment for erections. By addressing these foundational health issues, you're not just improving your erectile function, you're literally extending your healthy lifespan. It's a holistic approach that acknowledges the interconnectedness of your body. When you take care of your heart, your blood vessels, and your overall well-being, your erections will often follow suit. This isn't just about treating a symptom, it's about cultivating a thriving internal environment. So, we've walked through quite a journey today, peeling back the layers on a topic that's often kept behind closed doors, but which is incredibly important for many men's confidence and quality of life. We began by gently uncovering that common, yet often unrecognized, mistake during masturbation: the over-reliance on a highly specific, intense, and often non-natural form of stimulation, whether that's through excessive force, a very particular technique, or a constant stream of highly graphic visual material. Remember, it's not the act itself that's the problem, but the specific method that can desensitize your system over time, making it harder to respond to the more varied, natural, and often softer forms of intimacy. We talked about how this can gradually train your brain and your body's delicate nerve endings to expect a very high bar for arousal, leaving you struggling when that exact, intense input isn't present. The key takeaway here is the power of variety and gentleness, and the importance of retraining your nervous system to be more adaptable. We then delved into the crucial, yet frequently overlooked, role of your pelvic floor muscles. These aren't just for bladder control. They are absolutely essential for maintaining rigidity during an erection by helping to trap blood. We discussed how weak or dysfunctional pelvic floor muscles can lead to what we call venous leakage, effectively making your erection a leaky faucet. The good news is that simple. Consistent Kegel exercises can dramatically strengthen these muscles, improving both the hardness and sustainability of your erections. And beyond that, we touched on the broader significance of a strong core, which provides a stable foundation for overall physical well-being, contributing to better circulation and confidence in all aspects of your life. Finally, we explored perhaps the most foundational mistake of all: neglecting your overall vascular health. We established that an erection is, at its core, a vascular event. entirely dependent on healthy blood flow. If your blood vessels are compromised by issues like high blood pressure, high cholesterol, diabetes, or chronic inflammation caused by poor diet, lack of exercise, insufficient sleep, and uncontrolled stress, then your ability to get hard will inevitably suffer. We talked about how these lifestyle choices silently erode your cardiovascular system, effectively starving your penis of the vital blood flow it needs. The powerful message here is that by embracing a heart-healthy diet, incorporating regular physical activity, prioritizing consistent sleep, and actively managing stress, you're not just improving your general health, you're directly fueling your erectile function from the inside out. It's about recognizing that what's good for your heart is truly fantastic for your penis. And by addressing these core health pillars, you create an environment where your body can perform at its best. Remember, small changes can make a big difference to your health and happiness. This isn't about drastic overhauls overnight, but about consistent, gentle steps towards a more vibrant you. Each choice you make, each adjustment to your routine, builds towards a stronger, healthier, and more confident future. You are absolutely capable of making these changes, and you are not alone in facing these challenges. Many men experience these issues, and by taking these steps, you're empowering yourself to reclaim your vitality. I genuinely hope this conversation has given you some practical insights and, more importantly, a renewed sense of hope and control. Your journey to better health and stronger erections is within your reach, and it starts with understanding and action. Please, if any of what we've discussed today resonated with you, or if you have your own experiences or questions, share your thoughts in the comments below. Your insights could be incredibly helpful to someone else watching this video, and if you found this information valuable, please give this video a thumbs up. It really helps our channel reach more people who could benefit from this advice. Also, make sure to subscribe to my channel and hit that notification bell so you don't miss out on future helpful content designed to help you live your best life. At every age, you deserve to feel confident, capable, and full of life. Keep taking those steps towards a healthier, happier you. Live your best life at every age.